Welcome to this edition of the Dean's Video Newsletter. Today I'd like to talk to you a little bit about activities that are being undertaken with regards to the clinician scientist and what we're doing as a school, what we're working on nationally with regards to this particular stream of training for our physicians. For many of you, you will have heard about clinician scientists. Many of you will wonder, what is a clinician scientist? Sometimes the term physician researcher or a clinician researcher or clinician scientist are all used interchangeably. So a clinician scientist as an individual has dual training. These are individuals who have undertaken not only their MD training program, but they have an additional body of training that allows them to have a certain degree of expertise. Sometimes that's seen as an MD PhD, which would probably be the most common way that people would think about this. Other times it's a master's degree. Other times it's simply that there's been an additional amount of training taken during either their undergraduate period or in their postgraduate residency training or in a fellowship training program. It provides them with a skill set to do a specific body of research. And then once they're in as clinicians, they have protected time and they continue this research. That's a very classic sort of definition as to what this means. But when we begin to look worldwide, and certainly this issue of defining the clinician scientist and then protecting them is not unique to Canada. This is something that's being addressed worldwide because there's a consensus that we have an insufficient number of individuals trained in this manner. For us as a school, this is very important. It's part of our social contract. Not only do we deliver healthcare, but we should be delivering the next generation of academics and researchers. But we also need to recognize that the science of medicine really is changing dramatically as well, right in front of our eyes. And so we need to ensure that our learners, as they're coming through in the MD training programs, truly have an understanding about how science and research is conducted. Now, most assume when we talk about this that we're talking about basic laboratory bench type of work, but in fact we're not. This is a very broad stroke that we're taking. So on the one hand, we could well be talking about education research, something that through CERI, our Center for Education Research and Innovation, we do a tremendous amount of, understanding what are the teaching modalities. If you want to ask questions about population health, how do we scale up observations for smaller populations into much larger health questions? Well, that's what we do through the Center for Family Medicine Studies. All of us believe that medical training is a continuum. Right? Nobody would argue that it begins as an undergraduate and it goes right through to your graduate and eventually into specialty training for some individuals for that. So we need to look at training programs that view this as a continuum. Well, that's being done. Right? So if we look at what's happening in the United Kingdom, the Walport report really set out a standard for us to be looking at for allowing individuals to have time to enter into and leave the training exposure during all of their undergraduate training. It's working very well. The early results out of the UK model suggest that that is in fact a very stable model. When you look nationally within the Canadian boundaries, there's a lot of conversation around interprofessional research and training. And that truly is the direction that we have to be heading from a countrywide point of view. So what does it mean then to develop these opportunities with our other health professional colleagues so that the training is very broad? It's a tremendous conversation that's going on as we speak. As a school, we'll be taking a very critical look at all of this and playing a critical role into it. For me, it's a very important piece to recognize that this type of a training program that can lead to a group of clinician scientists is part of the fabric of our school. It's been a goal since I took on this role of dean. It's one that will continue as we develop further in there. So it's early days on a national conversation. We just held in February a national consensus conference here in London, bringing together critical partners from all aspects across Canada who have responsibility for training and funding of these programs to really have the discussion around what is a clinician scientist and what will we be doing. There's a reason we played a lead role in it. It's because it's so important to us to move it forward. So you're going to hear a lot over the course of the next 6 months to a year as this moves to a white paper and then to a position, but then as you actually see it become integrated into our curriculum and what we're thinking about with that. So an important piece of work that's being done here at Western and at the Schulich School of Medicine and Dentistry, but it has both national and international implications for our training programs. I look forward over the next time period to keeping you informed about this. So thank you for joining us. A very interesting topic today, but an important one to the school. I wish you well. Thank you.